Good morning, Singapore. It's Glenn and the Flying Dutchman, producer Sean Tupaz, Ivan Ranton, and today being a Tuesday, it is Therapy Tuesday, with this lady from the therapy room, Dr. Geraldine Tan. Good morning, Jerry.
Good morning, Jerry.
Good morning.
Good morning.
Nice to have you with us again.
How you doing?
Halloween version.
That was horrible.
Freddy Krueger.
Freddy Krueger's
no,
version.
no.
That's a Halloween one for you.
Yeah. So, Jerry, we're talking about autism and calm today.
Yeah.
It's known as autistic spectrum disorder.
Yes,
correct.
ASD.
So
Because
what-
it's an
what-
entire spectrum.
What is it?
I think a lot of people think of autism as some creature that is very alien, and in truth, they might do behaviors that are a bit strange. Okay, but we're going to break all those myths today.
Okay.
So, let's go with the very boring formal things. So they have the three different areas. So the behavior, so they might have repetitive movements, right? So you see the hand flapping or the rocking to and fro. You see them having poor verbal communication or non-verbal communication. So they will hit or they don't have eye contact. Very poor social skills. Okay, but these are what the book tells us, right? Actually, the autistic population are really lovely population if we get to know them. Yeah, and the flapping behavior, rocking motion is actually them trying to calm themselves. They're trying to soothe themselves in our world that is very chaotic.
Oh, that's interesting. That's
When I think of autism, I think of the movie Rain Man.
Yes.
And Dustin Hoffman. Is that the typical behavior of someone with autism?
So they picked out some of the classic behaviors, okay, but it doesn't mean that all the behaviors are similar. So even for each individual autistic adult, teen, or child, they have their own quirkiness. That's quite interesting. Yeah. So, yeah. Go.
Can I ask you something, Dr. Jerry? What is autism caused by? Is there something that triggers it?
Okay, so there are many kind of explanations for it. Some say it's a genetic defect. Some say there is a issue in the brain. Many explanations for it. I know at one time in Indonesia, it was very popular for the doctors to say, "Oh, there's too much mercury in the blood." Yeah. So they shy away from eating fish and things like that. Yeah. So a lot of
But it's not true, lah. But that's not true, right?
the mercury in the blood. There are still people saying that, but I don't know if there's enough research on that to safely say that it is caused by that.
Yeah.
Right. We are talking to Dr. Geraldine Tan from the therapy room, and the topic for today is autism and calm. Right now, here's Celine Dion. If you ask me to, on 1FM 91.3, good times, greatest hits.
So, Jerry, there's the flapping of the arms, there's the rocking, the lack of eye contact. Are there any other symptoms that we should be looking out for?
I mean, they tend to come to you, or they are in your space because they don't know social boundaries. Remember, they're not schooled in our world. So they might come really close to you, and you might feel that your space is being encroached upon. But until you tell them, or even if you tell them, they might not understand. So they don't have the theory of mind to understand from your point of view. Emotions may be a bit lacking also.
Right. How do we get people to be more understanding of people with autism? Because, when we're out, for example, right, and we come across someone who's behaving in that way, and that person might be an adult, I'm sure there are people who might misunderstand. who may not be aware that this person is autistic, and feel like, hey, this person is just trying to be funny, and then after they start, they get into a fight or something like that. Is that a common thing that happens?
The autistic person don't purposefully look for trouble.
No, of course, yeah.
Right? So they would be the ones that avert their gaze, not give you eye contact. So to fight with them might be a little bit difficult if they're not looking at you.
Right.
But may be strange in the way that they present themselves. They might be a little bit abrupt.
Yeah.
They might not respond to your social cues.
Yeah.
Yeah. So that's where we kind of observe them and go, okay, if we put a few things together, could they be having, ASD? And we give them a little bit of that white birth, which they need sometimes.
Right.
Yeah.
Ivan?
And talking about adults, right? Does
Yeah.
autism worsen with age?
No,
Not at-
it doesn't. Thank you for asking that question, because I've got a lot of high-functioning autistic individuals who are lovely, lovely people and are holding jobs, actually. So, yeah, as long as they practice, some of the therapy that they're given, they are engaged in a way that is comfortable for them, they generally are quite functional, at least for the high functioning ASD individuals.
Can we for a moment explain what you mean by high functioning?
So some of them have a pretty average ability. So not all of them sit and rock. Okay.
Yeah.
So they are able to comprehend tasks. They, just like you and me, their IQ can be average or even above average. Okay. They have abilities that are very specific sometimes. So they can follow processes better than you and I.
Okay, hold on. We're going back on air. Celine Dion, if you ask me to, right here on 1FM 91.3, Good Times, Greatest Hits. We are live on Facebook right now, on Glenn and the Flying Dutchman's Facebook page, as well as the 1FM Facebook page. And our guest for this morning is from the therapy room, Dr. Geraldine Tan.
Now, we've been talking about ASD, and Geraldine was talking about high-functioning individuals who can actually do certain tasks better than we can.
Wait, what is ASD again?
Autistic spectrum disorder.
Okay.
Order.
Am I right?
Yes,
Okay.
I love it when Eftin does his homework, Glenn, you don't do homework, right?
I don't. Just like everyone listening doesn't do their homework as well.
Yeah.
So I'm their voice.
Glenn's the voice. So, Jerry, you were saying some of these people are very adept at certain things. Is this why? What examples I would give you are? Is this why some people who suffer from ASD are magnificent artists, for example?
Yes, so some of them are savants. Savants have one specific skill,
Right.
and they're very developed in that skill. But even, I think some of the celebrities that we know, so Hannibal Lecter,
Anthony Hopkins.
yes, he is Aspergic. And for those that love their Pokemon, Satoshi Tajiri, yes, he is on the spectrum.
Wow.
And he's not shy to talk about it.
Right.
Yes.
What's the term you used for Anthony Hopkins early on?
Asperger's. But Asperger's
Oh, I see. Asperger's.
been collapsed into the autistic spectrum disorder, and they are on the highest on the highest level, where they have high IQ, they might not have high EQ.
Okay.
Social quotient, yeah.
I've got a question for you, Dr. Jerry.
Yeah.
How can you tell if your child has autism? I mean, from a parent's point of view.
Okay, so when our toddler, is born and everything, they go through that developmental stage, but you realize that your child is not responding to you or they have very poor eye contact, right? And they are, some of them, they start learning their ABCs and then they lose the skill, they lose that ability. Okay, so those are certain signs that we look at. The little ones, they might do repetitive actions like what we talked about earlier. So then I would encourage the parents to bring to the psychologist and have them assessed. We can assess them as young as 2 plus 3 years old.
Right. Okay. Yeah, I mean, I think that's the best thing.
Yeah.
If you're not sure, get them assessed.
I do have a question for Jerry when we come back about how we term ASD.
All right. In the meantime, here's Nickelback with How You Remind Me on 1FM 91.3. I think this ASD and all that, right? Not to be confused with ADD. I think some people, yeah. Some people feel like people with ADD are autistic,
There's a different spectrum of
Exactly.
Yeah, it's a different spectrum. Here's the thing. This is something I learnt because of the amount of work I do with the Down Syndrome Association. It is, correct me if I'm wrong, it is not right to say that someone suffers from ASD. They just have it. Correct?
It's not a suffering if you think about it.
Yeah. It's not.
Who says suffers from?
There are people who say it because it's not a disease, it's a condition.
Yeah. You suffer from stupidity, but you don't suffer from, autism.
But still, you can't say that.
Yeah, exactly. That's what I'm saying.
But a lot
I
of
don't know of
people
anybody
do.
who say it.
Yeah, because
Really?
we actually, you were asking how people can learn to deal with this. And one of our fans on Facebook actually said, perhaps one way of being inclusive is to be aware that no one suffers from autism, but they're simply a person who has autism.
So which one of us actually said suffers? No one, right?
No, but I've heard it. I've heard it outside.
I've never heard it.
Yes, I've heard it.
If I may be honest, I've never heard anyone say that so and so is suffering from autism. I've never heard.
it. And I just wanted to publicly say that. So I am right to say you don't suffer from it, you just have it.
Yes, absolutely. And we can learn so much from the autistic population. I actually love working with them. I worked with them since I was a teen. I do dance with them, and while everyone else was doing tuition, I was giving therapy for autistic children.
Oh, what kind of therapy do they require, Jerry?
So they have the classic, the ABA therapy, applied behavioral analysis therapy. There are a few other therapies that are out there, and it is working on their behavior for the more for those that actually need the more severe ones. And there's also occupational therapy. So the occupational therapist will work on all the sensory issues because many of them have a lot of sensory issues. So they get triggered. So sometimes when we see them acting out in public, it's because they are triggered. And it could be that the noise level is too loud. So they go, and they can't stand it. So some of them have earphones.
Yeah,
right.
Even in schools during the lesson because the ambient noise is just too much for them.
Right.
Some are very tactile, so they don't like to be touched. So one of the boys, I forgot because I'm very touchy-feely, right? So one of the little boys, I went, "Oh, hello," and he was like, "Pia!" He just smacked me, and I was like, "I'm so sorry, you don't like to be touched." Right?
Right.
Okay, hold on. We're going back on air. Nickelback, How You Remind Me, right here on 1FM 91.3. Good times, greatest hits. We are talking to Dr. Geraldine Tan from the therapy room, and the topic for today is autism.
Autism. Jerry, you mentioned schools. How do they deal with the education system that we have in Singapore?
Oh, this is so exciting. So I hope this mummy is tuned in, because this is a little boy that we've been working with for many years. I cannot remember, at least 4 or 5 years now. And I think, at the beginning, teachers didn't know what to do with him. He was running around. He didn't know the process of what a school is. So it took the entire team to work with him, to sit with him, to teach him all that processes. He's now in a mainstream school, and we are still constantly teaching him, but he's really settling in quite nicely. I think the whole COVID made him act out a little bit more, but we can deal with it. It's marvelous, because when the entire school comes together, you see all the little friends telling, so and so, please sit down, and it's such a delight to see how inclusive they can be.
Right. Jerry, we've been talking about children who have been diagnosed with autism and all that. But I'm sure you've also seen parents who, who perhaps maybe never expected to have a child with autism. What positive words do you have for them? Because at that point of finding out, many of them, they start to think about the future, and they don't know what the future holds, for their child. I mean, for the parents you have seen and you have counseled, what do you tell them?
I think the first thing is for parents to accept. So once the parents accept, they would journey with us and we would journey with them. But many times when we can't even cross this first hurdle, and they go, oh, but my child, they will grow out of it, because sometimes it's very hard to accept, right? So they'll say, oh, when they're older, they will grow out of it. But it's not true. Autism needs to be managed. Yeah, the behaviors need to be taught, because how their brain works and how our brain works is very, very different. Where the autistic child or the autistic individual, they view our world as very chaotic. You and I are wired differently. We deal with the chaos, but they are trying to find a structure in the world. So that's what I often explain to the parents, that they are looking for structure in our very, very messy and chaotic world.
Does that mean parents have got to go to the extent of even the home being a very structured environment for people with autism?
Oh, you don't have to change the environment too much, but the autistic individual may enjoy certain routine, perhaps, or certain spaces that they can go and decompress.
Okay. We're talking to Dr. Geraldine Tan from the therapy room, and the topic for today is Autism and Calm. It is 8:18.
1FM time check. Bye.
And we're back.
So Jerry, can I just ask you a question? So yes. For people, parents, if they come to you, for example, to the therapy room, you assess them, and then of course the early interventions. Am I right to say early interventions where you say, this is what you have to do? Can you help us by telling us a little bit more?
The early intervention program. So the early intervention that we work with, so they're multi-pronged. So you have the entire team working with them. So you have us working with the behavioral and the emotional. Okay. We also can work with the social skills part of things. The speech pathologist will work with them on the social communication. Okay, to learn words and to learn how to use the words appropriately in social contexts. Now that's very important, because they can learn, they know the words, but they might not know how to apply them. So that's another area. Then the OT, occupational therapist, will then work with them on all the motoric skills, because they can be a little bit not very coordinated, or the sensory issues may impede some of their functioning. Yep. So they would need some help in that area. So it's everyone coming together.
Right. So, I mean, for kids with autism, right? I mean, do any of them or can any of them go to a regular school?
Yes, yes, yes. So those that are less severe, they do go through school. Some even fall through the cracks. They are called weird. They are called introverted, or they are labeled all sorts of names. But they get through school. And I had one Japanese boy who came when he was, I think, mid 20s. So the mummy was at wit's end because he could study, but he couldn't hold down a job.
Oh, okay.
Oh, okay.
He was miserable like anything. Because
That's normal. What many people are like that also. Many people without autism are like that.
You know, there are a lot like that.
Yeah, it's true, right?
Yeah.
Yeah.
why are you trying to get them to agree with you? No one agrees with you. I'm just teasing you. Yeah. So the misery was born out of later on we found out he didn't like to socialize. But in most jobs, you need to interact with people. So we were brainstorming the different jobs that he could do that there's minimal contact with people. And guess what we found?
What?
We were discussing and mom said, "Oh, but you like to eat sushi." So I'm going to send you back to Japan to understudy to be a sushi chef.
Wow.
Yeah. And she was like, "Okay, that's it." And he was so delighted. I was so pleased. Although I had to send him away, but yeah. I was
Wow.
But you know, a sushi chef has to socialize as well.
Yeah.
Right? I mean, we've got
not all.
friends. We've got
Yeah,
friends
we've
who
got
are
friends.
sushi chefs.
Yeah. But
right?
not all.
And
Not
they're
all.
there. They're drinking
Yeah.
with everyone at the counter. You know.
That's the more extroverted one. He
Yeah.
can remain there, do his sushi, and just plate it.
Right.
And yeah.
It's very interesting. We have a comment on our Facebook page that is, I think Jerry will be able to relate to. It's from Joel. Initially, I too assumed that the doctors overdiagnosed my son. Today, after 4 years, I'm glad to have discovered this early. This way, I am now able to get early intervention and to learn from professionals the many techniques used to cater to the special needs of my son. So sometimes I can imagine how a parent's initial reaction to a diagnosis would be to fight it.
Yeah.
This can't be happening to my child.
Because they're scared as well.
Yes.
You know?
Yes,
Yeah.
they are.
I think every parent will be afraid to know something like that, and some of them are in denial and like, no, this cannot happen to my son. But I've got a question for Jerry. Jerry, what are the no-nos for parents, for adults to not do, knowing that you have autism, and what you should not do for your kid or that person?
Maybe Dr. Jerry can answer this when we go back on air.
Stand by.
10 seconds to traffic.
Yeah.
Traffic.
Okay, we know we've got the usual delays on the expressways. I mean, that much is quite usual for this time of the morning. PIE towards Changi, an obstacle on the road at the ECP City exit. BKE towards Woodlands, a vehicle broken down at the Dairy Farm Road entrance. Those are two areas to look out for. Other than that, it's the usual delays. So please stay within the speed limit. Have everyone buckled up. Be safe as you drive today.
Good morning, Singapore. It's Glenn and the Flying Dutchman, Ivan Ranson, producer Sean Tupaz, and Dr. Geraldine Tan from the therapy room.
So, Ivan, what was your question again for Jerry?
So my question for Jerry was, if you understand that your kid or that person has autism, what are some of the things that you should advise them not to do? That means it's a no, don't do this because it will then worsen your condition.
I don't think it worsens the condition. Okay, worsen the condition would be you hide them. Please don't hide them. So I had a 33-year-old Indian girl that came and she was hidden in the house for 33 years until she came to Singapore.
What?
And at that time, she was still being hand-fed by the helper, and she was wearing adult diapers. She couldn't even tell us that she needed to go to the toilet. Yeah, it was that bad.
But how did it get to that though? How?
in India, I think is the face thing. It's very shameful for the child to have special needs. So the family is very rich or well-to-do. That means it's even more shameful, right? So she was just kept in the house and looked after by a helper. They could dedicate one helper for her. Yeah, so it was very appalling because even when I was doing the testing for her, she defecated in her diaper and she couldn't even tell me. Yeah, she couldn't even hold her own cup and drink from the cup because she was being fed. Yeah, so that's the hugest no-no. Do not hide your child. Celebrate your child. Every child needs to be celebrated. We love all our children. The other thing is, please do not put them down. Don't scream at them. Don't shout at them. They are trying. Many of them are trying. And for the parents, please get your own support. I think yesterday we all read in the papers, one of the fathers actually, it wasn't an autistic child, but his daughter had I think anxiety disorder, and eventually he had a scuffle with her and killed her. Yeah. And it really pained me because I think we the parents, the caregivers, need to reach out for more support. And there are forums, there are support groups that are out there. So, the mummy I was talking about with the 8-year-old boy, she runs a support group. Lillian is her name. So let me know if you need to be connected with her. She'll be quite happy to do that.
Jerry, this has come up on our Facebook page a couple of times, and Joel is trying to explain it to people. Maybe you can as well. People with autism might have ADHD, but people with ADHD do not necessarily have autism.
What's ADHD?
Attention Deficit Hyperactivity Disorder.
Oh.
Or ADD is Attention
Deficit Disorder.
Yeah, but this has hyperactivity as well.
Oh, wow. So what's an example of a person with hyperactivity?
I mean, the restlessness, the impulsivity, the constant on the go, talking nonstop. There is still a lot of social skills. They have very high EQ.
Right. That's me on a normal day,
I think so. Yes.
Yeah.
We just diagnosed Glenn.
The only reason I'm a little calm is because I had 8 pints of Guinness last night.
That's why. That explains.
That's why you guys have a chance to talk this morning.
True. But is it true that people with autism might have ADHD, but it doesn't work the other way around?
Yes. So there are two separate disorders. So it can comorbid. That means it can come together. But these are two separate diagnoses. Yeah. So a child or someone with ASD can also have depression. So there are two different disorders that we can diagnose them with.
Okay.
Yeah. So that comorbid. Yeah.
All right. We are speaking to Dr. Geraldine Tan from the therapy room about autism and calm. Up next, Fleur, who looks like me. Shawn Mendes. This is Mercy on 1FM 91.3. We are live on Facebook, by the way. Okay, hey, maybe we can talk about the calm part now. Okay,
Yes.
this is autism and calm, right? So okay, for parents, let's say, who are at their wits' end, and they're suffering from anxiety attacks, and I think it may be more common than we think. Because they're constantly worrying about their child who's autistic. For the people who are tuned in right now, who may not have the privilege to go down to you, and see you, Jerry, what can they do to remain calm?
We love to teach our little ones how to do the breathing. So we talked about breathing a few times. But for the little ones, it's very difficult for them to grasp the concept. Yep. So we will teach them to smell the flowers. So they go, and they smell the flowers. And what I like to insert is you count your age. So if you're 3 years old, you count 3. if you are 5 years old, you count 5. Of course, it gets more difficult when they're older, but they figure it out and just go. And then they blow the candles. The number of candles that they counted, they will blow the candles.
Oh.
Yeah.
Oh, wow.
Yep. So this is one of the breathing technique that we adults use. The little ones can use also.
That's very interesting.
No, I just wanted to say also positive strokes to tell the children or the person, you're doing well, you're doing good. Am I right to say that?
Yes, except that sometimes we overuse one phrase.
Yep.
So I learned that the very hard way for one of the big, boys.
Yep.
And we were doing things with him and he was like, well done. And we were like, oh no. Every time he did something, he would clap and he would tell himself, well done. And we realized, we only use that one phrase with him, or the team only used that one phrase. So we came up with 99 different kind of phrases to try and rotate and use.
Right.
Because sometimes it gets quite triggering for them
Okay.
if they only hear one phrase.
Right. This is good. I mean, because I think there are some parents right now who may be experiencing that with their child, so there you go. That might be the way to work around it. Yeah.
Sorry, FD, is there any question on Facebook Live for Dr. Jerry?
No, we've answered most of them that have come through. Another question that's coming through from Ren is, Dr. Jerry, do you see instances where children with autism also have epilepsy?
Well, it is possible. So different disorders can come together. So medical conditions. So you can have autism and asthma, for example. You can have autism and, other sort of medical ailments. It is a possibility, but it doesn't mean that when you have autism, you have epilepsy, or if you have epilepsy, you become autistic. No, it doesn't apply that way.
Wow. It just makes things a lot harder.
It must be so difficult if you have an autistic child who then has epilepsy. It's never mind you. How does the child deal with that second condition?
Sorry, Dr. Jerry. Okay.
Yes.
With all the therapy, is there a medication? Okay, I won't say medication. That's not the word for it. But is there something they can take to calm them down?
Well, the doctors tend to advocate like fish oils to help them, the vitamin Bs to help them. There are other medication out there, but better left for the psychiatrist to kind of give their opinion on that one. Yeah.
And then the next question I want to ask you, Dr. Jerry. Sorry, today I talk a little bit too much.
One last question,
Go
Mar.
ahead. Go ahead.
No, it's okay.
Okay, for viewers, listeners who actually want help, is there a website? Is there a number they can call if they need more help?
There are many organizations out there. The Autistic Resource Network, forums that are out there. Even on Facebook, you just Google special needs, parents, families, So you would have a lot of resources out there, and I always encourage parents to support parents, because that's where you get the best resources, tried and tested. And I always encourage the parents to be brave, to go out, try different activities. Don't limit yourself to only therapies. These children need the opportunity to try mainstream activities.
Yep.
And if the coaches or trainers are comfortable dealing with them and they know how to manage them, these children would do beautifully.
Right. What about just one last question? I think we do have time for one last question, and then you can wrap it up. Jerry, for adults with autism, I mean, do they have to continue going for counseling sessions? Do they ever become independent
Well,
later on in their lives?
they are independent, just that some of them have issues with emotional regulation.
Okay.
Sometimes they have issues dealing with social skills or in their workspaces or
Right.
in environments. And it's good to just come, check in, and we help to just iron out some of these challenges. And they can manage all the other parts pretty well.
Right. Can they consume alcohol?
Of course they can.
That's
I mean,
for
when
you.
they're at that age, I'm talking about when
Yeah,
they're
legally.
adults.
It's an interesting
absolutely.
question.
Right.
It is an interesting question.
I'm just thinking because once they're on their own, they're independent. They're they've lived with this condition all their lives. They're adults. They have their friends. When they go out,
Yeah.
can they have a drink?
It is an interesting question. I've never thought about it. Legally and technically they can. I've never heard that they would take it because they remember that they are also very sensorial. They
Yeah.
might or might not like the taste. Yeah.
I see.
Okay.
Okay, here we go.
All
Stand by.
right, stand by. Lisa Loeb and 9 Stories. Stay, I Missed You, right here on 1FM 91.3. Good times, greatest hits. I think if we give Jerry a nice pair of glasses, Lisa Loeb glasses, you look like an Asian Lisa Loeb. Do you remember what Lisa Loeb looks like?
Yep.
Okay,
She
go
does.
Google later.
Google.
Very sweet, looking lady.
But I have to say, Jerry, that many people have come onto our Facebook page and thanked us for talking about autism today,
Right.
because it is not discussed enough publicly.
Yeah.
So
Yay!
we did a good thing today.
All of you did a wonderful thing. Yay!
Thank you so much, Jerry. Thank you very much. That's not a good photo of
Oh, that's
Lisa
not
Loeb,
Lisa.
though. Yeah. There are nicer
This
photos
is
of
current,
Lisa
I
Loeb.
guess, Lisa
Where?
Loeb now,
It's
Okay.
kind of.
Loeb now.
Yeah, never mind.
Young.
Those cat eye glasses, the one that.
Yeah.
the cat eyeglasses.
Because she was one of the first artists I actually played when I first started out
Is that right?
as a radio DJ. Back in 1994, I believe that hit was number one. Stay, I Missed You.
Yeah.
And I mean, obviously, she looked a lot different. I remember her from back in the day.
Back in the day.
Okay. Any last words, Jerry?
Yes. I want to tell all the parents and encourage all the parents. Autism doesn't come with a manual. It comes with a parent that doesn't give up. So, hang in there.
Hang in there. Special, extraordinary parents.
Yeah.
You guys are strong and you guys love your kids, and I'm sure everything is going to be all right. All right. Thank you so much, Dr. Geraldine Tan.
No worries.
We'll see you next week.
Be here.
Always
And
glad to have you. All right.
bye-bye.
Bye-bye.
Bye.